We've got a patient here presenting with symptoms of immune-mediated inflammatory diseases, multi-system inflammatory syndrome, and viral cardiomyopathy. What's your best diagnosis?
I'd say it's likely an autoimmune disorder based on these symptoms.
I agree the multi-system inflammation suggests something systemic like a viral infection or possibly even cancer.
Or maybe it could be a combination of both, given how complex the body can be.
All right. Let me tell you what I think we've got here. Hypervolinemia.
But Dr. Hawks, those symptoms don't match with hypervolinemia.
And treating them as such could risk severe damage to the patient's body.
You're right, Randall. The glossectomy you're suggesting is risky. We need a more precise diagnosis and treatment before we proceed.
I didn't suggest a glossectomy, screw you, Frank. Not even Hawks would be stupid enough to demand one.
No. I've made my decision. It's hypervolinemia for sure. And joke's on you, twerp. It's glossectomy time.
Hawks! I called you into my office because I've heard about your plan to perform a glossectomy on your patient who you believe has hypervolinemia.
Yes, it is true that the idea comes from my experience as a doctor in the Vatican, where I have saved many lives of popes. This time I'm sure I am right, and I can't let the fear of failure stop me from doing what's best for my patient.
Hawks! Your decision is based on something that isn't true. We've had discussions about hypervolinemia and glossectomy before, and it was agreed that this course of action should not be pursued unless there are no other options left. Your idea isn't just reckless. It's irresponsible.
You're full of disinformation, and I won't hear any of it. Just because you didn't know I worked for the Pope doesn't mean it didn't happen.
You're right. Who else would I expect to proudly admit? Only 4 popes have been alive the past 20 years.
If only there was a commandment against sick burns like that.
So I've been doing some research on this hypervolinemia case, and I think we might have made a mistake with the glossectomy.
Mistake? Are you kidding me? Hoss is the best surgeon around? You're questioning his expertise.
It's Hawks we're talking about. There's a patient in critical condition now, and your lips are sewed to his ass tighter than a unit in a human centipede.
And whose fault would that be, I wonder? Yours or mine?
Assuming both of us had free will at some point before deciding to get jobs at this hospital, we're both at fault.
You idiots. How could you let this happen? You nearly killed him. Hypervolinemia was a misdiagnosis and glossectomy was the wrong treatment.
But Dr. Hawks, we were just following your instructions.
We did our best, I swear.
I don't know what happened. Maybe it was just a mistake.
Mistake. You almost killed someone due to your incompetence.
Why don't you tell us more about your time working in the Vatican?
I swore an oath that I would not divulge any secrets.
What if holding those secrets are a sin, Hawks? Is there a chance you're failing to do the right thing? Opting to cover up crimes?
Randall, why are you looking at me as if I'm a president?
Hawks, I understand tensions are high, but satire is not right for this occasion. The patient is still dying.
Then what are you wasting time for? Get the hell out of my sight.
What was it like working for the Pope?
Do you promise to swear to secrecy if I tell you?
Okay.
I made the whole thing up. I never worked for him, or the Vatican.
Oh, I was hoping for an interesting story.
No, you were just hoping I would confirm your bias to one extreme.
Anyway, how are your patients doing?
Oh, it's been a tough week, but we've managed to stabilize most of our patients.
Good, I guess. Anyway, time to go check on my patient. I think I figured out what's wrong with him.
Hawks, you're not wearing proper protective medical equipment. You can't just storm into an operating room like that.
This isn't a game of follow the leader. Hawks, you need to follow procedures.
You've got no right coming in here like this, Hawks. It's irresponsible.
Shut up, people. I'm telling you, hypervolinemia was wrong. We've all been misdiagnosing these patients. I solved it during lunch with Dr. Johnson. We now have a new diagnosis. Splenogeneal fusion limb defects micrognathia syndrome.
So, what's the prognosis?
Prognosis is grim, but not hopeless. We'll need to work quickly and efficiently. I'm glad we got the right diagnosis for that patient.
I am too. And I think it's because you finally put down your pride and let me help you.
Pride? That has nothing to do with it. It was just a matter of knowing what you're doing, which isn't always the case.
That's not true, Hawks. Your so-called experience as a doctor in the Vatican who saved popes' lives is just that. So-called, and only hindered us from finding the right diagnosis.
Whatever you say. I have numerous friends who would confirm I worked in the Vatican.
Johnson isn't one of them.
He swore to secrecy. God damn him. This is a more pressing matter, Tracy.